So PRP stands for platelet-rich plasma. And essentially, we've over time discovered that this is a useful treatment to help prevent hair loss. It's where there are existing hairs, people have reported that their hair looks stronger and has grown longer in some cases, so giving the appearance of a more dense scalp. So yes, people like PRP for regrowing or for strengthening their hair. So PRP, platelet-rich plasma, essentially means we're taking a component of your own blood, the platelets, which are brilliant at helping the body heal itself. We're separating that from your blood. So it sounds graphic, but all that's involved is taking a small sample of your blood, spinning it down in a specialist machine to separate the platelets, and with all the growth factors and all the goodness that we want to concentrate and re-inject into the area of concern. So for hair loss, it has little downtime, be it half an hour or so. The results of PRP are individual. What does that mean? It means in one person might have this treatment and see a result sooner than another person might. But the beautiful thing about PRP is many people consider it a natural treatment because you're taking a sample of your own blood, so you're not going to be allergic to yourself. And so we spin that down, taking out or concentrating the goodness to then deliver this to an area of your scalp that needs that support. So we recommend having a treatment once a month for the first 4 sessions. And after that, you can space them out to have a maintenance treatment between, say, once every 6 months or once every 12 months. So it depends on where you are in that treatment plan. The effects of PRP may last 6 months to a year once you've completed a course of treatment. PRP has little downtime where it's used for hair loss, and so it's suitable for most people. However, there are certain specific medical conditions that would need to be excluded during a consultation. But one of the beautiful things about PRP is it's often considered a more natural treatment for hair loss. And that's because we're taking a sample of your own blood and giving you your own body products in an area that you need it to help support hair growth. So I would say for most people, using this concentration of plasma of platelets is suitable. However, there's certain medical conditions that need to be excluded. And so that's why it's important that you see a specialist and have a consultation to assess your suitability. But for most people, PRP is suitable. Also importantly, there are some people that are allergic to other medications for hair loss, and they often find PRP is a gentle enough way to begin to address hair loss without suffering the side effects that may come with some common medications. But again, there's so many things that are good for hair loss. And PRP is also brilliant because you can combine it with other treatments to get a synergistic effect. So within PRP, your own platelets are taken from your own blood. So essentially, it's your own body products. So thankfully, likelihood of allergy is minimal to non-existent. But the treatment itself involves using a fine needle to carefully inject these concentrated growth products near the roots of your hair to help regrow hair. So the side effects of that, there's a little discomfort that may be felt after the procedure, but really after that, and apart from, and also perhaps a little bit of redness in that area, but in most people that'll be covered by your existing hair. So outside of those two things, really, they're minimal to no side effects. So there are very little side effects that one can develop after a PRP treatment, thankfully. So just a few things I'd suggest doing before your treatment. Number one, wash your hair at least the night before or on the morning of your treatment. So that way, before the PRP is delivered into the scalp is nice and clean and ready to receive the new goodness. After the treatment, there are very few things to avoid. Avoid washing your hair for 12 to 24 hours after the procedure. Having some of the PRP on your scalp anyway will help to promote repair and healing in that area. So it just give your scalp a break for 12 to 24 hours. Also, avoid sun exposure. I would say look after your scalp as usual, minimizing sun exposure. That area you may feel a little bit of discomfort immediately after that treatment, but it settles quite quickly. But this is not an area that you then want to expose to sun for a protracted period of time. But really, after PRP, there's very little downtime, and there are very few things that one would need to avoid.